So it's an absolute pleasure for me to have the chance to be here today to give you an update on some of the work we've been doing in the patient support side of things. And it's been, as you know, quite a year. This clicker's not working, so I'll just see if I can revert to manual. It's been a year for all of us, hasn't it, with the pandemic, and I've taken the liberty of using some illustrations from this wee book, The Boy, the Mole, the Fox and the Horse by Charles Mackesy, and I do have his permission to use these, I should say, because I think it illustrates very well how we've all felt through the year at times, but especially for those patients that I have the privilege of meeting and speaking to and supporting. It underlines often that emotional, that mental, that social side to illness that we don't always recognise. And of course it says these are dark clouds, said the boy. Yes, but they will move on, said the horse. The blue sky above never leaves. And that's been important, I think, for us all to keep in mind this year, but especially our patients. So what has the year looked like for the Patient Support Service? I'm sure you've seen graphs that are something like this in other fields. We started the service in 2019 and it trickled away, but then the pandemic came, COVID-19 came, and our Ask Antruck feature that we began to allow the public to ask questions about vaccines and antibiotics, it just brought them in droves to the website. And I think Alison would bear out that the web hits of those times reflect this kind of graph as well. 18,000 hits on the website about September 2020, but up to something ridiculous like 44,000 come February this year. And that's what's happened in the Patient Support Service. We were pretty inundated with questions mainly about, can I have the vaccine if I'm on antibiotics? Can I take a course of antibiotics because I've just had my vaccine? Will a COVID test be affected by my antibiotics? Will I be covered with the vaccine if I've already been on antibiotics for a long while? People were really concerned about these things. But alongside that came the other inquiries that we're more used to as well. And I thought I would just bring these pie charts again. The one at the top is the one you saw last year, where in our time since we began, most of the questions were around UTI, people with a chronic recurring form of UTI. So about 48%. But then you can see in this last year, suddenly COVID questions related to antibiotics really took off, and they took up nearly 60% of our inquiries. And the graph to the right is where I've taken COVID out of the picture, just so that we get a real sense of what else is going on. And you can see that all areas have inquiries. The one that surprises me is respiratory being quite low, but resistant UTIs, recurring UTIs, is just increasing. We're at almost 60% of our inquiries around that topic now. So I thought that would just give you a flavour of the direction of travel in terms of what patients are concerned about, what they're asking about. And so in the last year we've been involved in all sorts. Sort of three main threads really. There's the individual patient support, and I'm going to say more about that because that's the important bit. But more and more I've been involved in the advocacy side of things, speaking up for patients, speaking on behalf of patients, writing articles about the role that we have and how we can work together, working with some of the external organisations such as NICE have come to us and said, would you come and be part of our evaluations and give us that patient voice, that overarching sense of it. And of course we've now spent a bit of work collecting on patient stories to put on our website, to put in articles, to put in leaflets, and recently to do some of the video work, such that you've just seen. That was work we did with BD, but we've done our own videos of late and we've been doing some more today. So it's been quite a busy year for us, and it just reminds me, of course, that what it all comes down to is how we support these patients. That's what we're really all about, the Patient Support Service. We don't have the answers sometimes, but the important thing is to have that listening ear, that availability. And this illustrates for me how it is for these patients, how I view them sometimes. Sometimes as the horse. what's the boy? Sometimes just getting up and carrying on is brave and magnificent. And that's how I see it from my end a lot of the time. So in terms of supporting them, we've got lots of different ways we go about that, and it's been lovely this last year to have the award from BioNow that recognises that this patient support programme is quite unique, that it's been reaching out and supporting patients where there's been nothing else for them in the past. And the Ask Antruck has been a big help, particularly during the pandemic. And I probably don't need to say too much more about it because Colin talked about it earlier too. But what's been interesting for me is the public can ask the question and we say we'll try and put the answer on the website. That wasn't good enough for most of them. There was a wee line that said, but if you wish a personal reply, please email the patient support box. The vast majority did that. Now that's interesting to me because although they had the generic answer on the website, they wanted personal reassurance that it was okay for whatever they were asking. And the green sign there, being a pharmacist by background, is one I know well, but that has inspired us to work more closely with some of the community pharmacies as well, to try and help them, assist them, engage with them, help prepare them to talk more to patients about the whole issue of antibiotic resistance. And I'll show you some of the work we've done around that in a minute or two. So in terms of providing reliable, trustworthy information, we keep increasing what we have on the website. I know you won't be able to read this, it's a bit small. It's just to give you a wee quick glance of some of the new web pages. So resistant infection in terms of bloodstream infections, respiratory infections, sexually transmitted infections. That's been the 3 new areas that we've introduced this year. We also had the pleasure of working with Costello Medical on some new bespoke patient leaflets. Lovely to see Will and Debbie here today, who very patiently worked with me on this as we put together half a dozen different leaflets on topics that patients wanted detailed information on. So we're down to the level of particular bacteria because a lot of these patients want to know exactly what they're dealing with. And so these have now been used in terms of sending them out individually, but also we'll have a whole section on the website coming soon that they'll be downloadable as well. And then just recently we've updated some of our more general leaflets. So this is the next one you maybe saw at the desk on the service that we provide to patients and inquirers, and using the stories of Lisa and Rhonda to illustrate just how people can use the service that we have to perhaps get that trustworthy information, to get that support. And we have another couple which is going to be used in this work with the community pharmacy chain that we're about to start. Very excited about this because I remember my days as a community pharmacist, and I'll be quite honest, I wouldn't have probably had the knowledge and the courage to speak to patients about their risk of antibiotic resistance. And so we're helping empower these pharmacists to know how they can introduce it, what they can talk about, and we're there to support them, and particularly for the patients to have leaflets to pick up that make sense to them. And you know, one of probably the most interesting developments in the last year has been bringing patients together in small groups. You can imagine a lot of the time when we're talking to them from our service, we can't solve the problems. We can't tell them what antibiotic is going to work. We wouldn't even attempt that. We don't give medical advice. What we give them is time to be listened to, time to think through what's going on, help them to distill down the questions that they might have for their doctor, help them to think about what's the information they need to know next. And what we've found is these virtual groups have been such a help and such a support to them. It's almost like a virtual group behind the scenes, isn't it? And this is really what they would be thinking. Everyone's a bit scared, but we're a bit less scared together. So we're back to the horse and people being a little less scared together. And that has been interesting for me because that has provided great help and support to people, just to be able to talk to someone else who's walked that pathway, a little less isolating, a little less lonely, and somebody that understands, because you would hear both of our patients talk about how difficult it is sometimes for their friends and their families to understand what they're going through. And so on the basis of our team, it used to be just me. I'm so pleased it's not just me. We did have Jodie for a long while, who was a nurse up in Aberdeen, but COVID put a lot of pressure on her and she was unable to continue her work with us for the time being. So I'm really delighted that we have Jade and Sadaf, who are both doing about 8 hours a month to support me in this role. It's primarily to allow me to have some time off, holidays, and it means that the service is totally supported. And you've got Session's name at the top. Session is our student intern who's with us this year, working with myself and Alison and Claire in the fundraising. Session, give us a wee wave so that everyone knows where you are. He's sporting the Antruck t-shirt, and we're trying to give him some really interesting projects, but that really help us and the patients as well. So Jade can't be with us today, she's in her day job, but Sadaf, I'm delighted to say, is here. It's the first time I've met her face to face as well. Sadaf, would you like to come up and say hello to everyone and introduce yourself? So Sadaf's come down from Manchester today and come to join us. And she and I have been working together for a few months now, so welcome Sadaf.
Thank you.
Tell us a bit about yourself. I've told you where you live and your family situation, what job you do.
So, like Arlene said, I'm from Manchester, and I'm a hospital clinical pharmacist by profession on my day job. I'm a mum of two, I've got 2 boys, so I kind of like juggle work and home life, and it's just finding that work-life balance for me. I joined Antibiotic research in April this year, and so in between my job and looking after the kids, I try and fit in, just where Arlene needs my help, and I'm really enjoying it so far.
So if I can just ask you, Sadaf, why did you want to work with the charity?
As part of my job as a clinical pharmacist, I overlook the antimicrobial stewardship in the hospital. So I'm an antibiotic pharmacist, and this aspect of the job in terms of the patient support kind of gives me like a full overview of my, ties in my professional job and this, because in my day-to-day job I'm kind of, looking at patients and reviewing their antibiotics and ensuring that they're correct and, just ensuring that they're appropriate for the patients. But often you don't get a chance to kind of, speak to the patients about their experiences because your day-to-day job is really, really busy and you're just so focused on getting things right for the patient. So this aspect of, working with antibiotic research gives me the opportunity to actually look at things from a patient perspective, to kind of see what their experiences are, what their point of view, and it ties in really well with my job as a pharmacist and in my stewardship role, because it provides me with an insight into what the patient's mindset is as well. And often I think patients can be quite reluctant to speak to healthcare professionals when they're in a situation where they are being treated with infections, or they've had a number of courses of antibiotics, and but this aspect of the antibiotic research job that I do allows me to kind of listen to those patient stories and like I said, just really appreciate what the patients are feeling and going through. And I think it ties in quite well.
Thank you, Sadaf. And it doesn't need said, doesn't it, that we have got a wealth of experience there in having Sadaf on our team with that clinical knowledge and working in the field of antimicrobial pharmacy. And I should say Jade has a very similar background. It wasn't by design, it's just they were the 2 magnificent candidates when we interviewed. And a final question, Sadaf, what has been surprising to you, perhaps, when you've spoken to some of the patients or responded to their inquiries?
I think, surprisingly, when I speak to patients, or when we discuss things with patients on the support line, is how they feel like they are kind of like the only ones that are kind of, you know, experiencing these infections, or they are not aware that it's actually, you know, something that quite a lot of people are going through in similar situations. And a lot of the questions that we generally tend to, you know, answer, patients at the end of a call may say, well, is this something that's commonly occurring? Is this a common question? You know, I kind of found that quite surprising, because I feel like you know, like you said, we need to probably have more awareness amongst people about how actually common these infections are becoming. So yes, I think that's what's really, you know, I've learnt a lot from.
Thank you very much, Sadaf, for coming and joining me today. And I think, you know, I would echo that sometimes what we think is going on in patients' heads is not necessarily what actually is. And that makes it even more important, doesn't it, that we listen to them really carefully and pick up from that. So for me, and I hope for you too, it's very reassuring to know that we have a team of really great people who are running this programme. And so when I'm off on holiday, I have complete peace of mind that it's been well looked after. So thank you for that to Sadaf and to Jade. So just finishing up really, I suppose just to keep in mind that the main thing we do is about supporting patients one-to-one. And I try hard never to lose sight of that, because it's so easy to get involved in so many other projects and things. But, you know, sometimes we're on a call with a patient and it's really complex. Often by the time they come to us, things have got difficult and they don't know what to ask, they don't know where to turn. And often this can be our experience, you know. The wee drawing says, I can't see a way through, said the boy. Can you see the next step? Yes. Well, just take that, said the horse. And often that's our experience of walking this road with patients. It's about what can they do next? Who can they ask next? What question do they need to ask next? And it's never a case of we solve a problem in one phone call. Sometimes we do, but it's rare. But I think just to feel listened to feel believed, is often something that we maybe don't realise means more to these patients. And one of the things we're always doing is looking and asking patients, having built a relationship with them, if they would be willing to share their story. And this is some of the new stories that we hope to have ready very soon. Session's been working with me to learn how to record stories in a way that has an impact on the reader. And so, how do you finish that really? I think Kevin in his address made it very clear that these patients have a story to tell, they have an impact to make. But for them, of course, they're living this, they're living it every day. And I just find it an absolute privilege to meet them and to be able to tell their stories, because they are so resilient with what they go through. And what's lovely now is there are some of them that I met in the early stages who are now at the stage where they're better, they're getting better, they're well on the way to recovery. Some of them are still struggling through. But isn't it nice to be able to say, you know, one day you'll look back and realise just how hard it was. That was such a tough journey, and look how well you've done. And I thought earlier, Colin, maybe we can say that as a charity too, you know. It is a tough journey, isn't it, to start something new, to plough on, to face a pandemic, but just to be able to look back and say, yeah, we've made progress here. And so on that basis, what I would like to do is just leave you with one final story, because the patient telling their own story is much more powerful than me telling you.
My name is Mary. I live on the east coast of Scotland. I'm married with 2 grown-up boys. I've just recently become a granny, which we're absolutely thrilled about, and I'm really trying and wanting to be well, to be a good, fit, fun granny. So I've been suffering with a urinary tract infection for 30 years since the birth of my second son. And it has gone from occasional infections, maybe once or twice a year, to 3 or 4 times a year, to a chronic condition that I find myself with now, whereby I can't come off the antibiotics, not even for 36 hours. And if I do come off the antibiotics for any reason, I become very ill very quickly. And obviously the antibiotics have massive side effects, particularly when you take them constantly. Living with an antibiotic resistant infection affects my life in various ways, but probably the biggest thing is that I live in fear all the time. You just never know when this thing will strike, and it comes day, night, anytime, and for me it arrives in a very violent fashion. I'm very quickly very ill, and any plans you've got are cancelled. What scares me most is about antibiotic resistance is the antibiotics not working. I fear one day I might have to have my bladder removed. I fear that this bug might actually get me in the end. It's really, really hard sometimes to keep your spirits up. There are days when I am barely functioning. And when you have an infection, you feel like your life is shrinking away from you. And there are days when you feel that your life is just not worth living, or a life like that is not worth living. And it materially affects your quality of life, and it materially affects my husband's quality of life. Really, if I'm honest, this situation for me has become desperate. You know, I feel desperate sometimes because I have got so much to live for. I've been blessed in many ways with good health, and I've had a lot of luck in my life. I've met a wonderful man to whom I've been married for 33 years. I've got 2 fabulous children and now a little grandchild. And this is a blight in my life. And there are times when I feel completely desperate about it. And I feel lonely and lost and trying to find an answer on my own. And it's very, very hard. Very hard sometimes. This is vital research that is being done for all of our futures, and it relies on charitable donations. So please contribute. I certainly will be, because it's my future and it may well be yours.